Good morning, everyone. Good time of day for persons who are joining outside of Jamaica. And we are now live streaming for International Web Poison Prevention Week. Are you hearing a feedback in the background? Please tell me if you're hearing a feedback. So this morning we will be having a very engaging and impactful panel discussion. The 13th International Lead Poison Prevention Week. It is observed from October 19 to 25. And this year's global campaign is No Safe Level. Act now to end lead exposure. This highlights the critical need to protect children's health from the unacceptable risk of lead exposure. The campaign builds on past successes, such as the ban of lead in petrol and the progress made by many countries in implementing laws and regulation to limit lead in paint, and especially in areas where children are frequently exposed, like homes, schools, and playgrounds. Jamaica has experienced lead poisoning through exposure from factories and informal lead acid battery smelting. In response to the country has been strengthening its regulatory framework to establish a standard for lead in paint that aligns with international guidelines. And for the past 13 years, CARPAIN has championed campaigns advocating for policies to protect children from lead exposure. This ongoing commitment continues through this webinar, featuring a panel discussion with academia, civil society, and government stakeholders who will share their insights on effective partnerships and policies for preventing lead exposures in children under the theme Preventing Lead Poisoning through Partnerships and Policy. At this time, I will be introducing to us our panelists for this morning. And I am inviting all of them to turn their camera on if they can. We have three panelists with us this morning. Kimberly Hibbert. Kimberly is an award-winning journalist and communication professional with over a decade of experience. She's the communication manager at Jamaica AIDS Support for Life. She is the first vice president of the Press Association of Jamaica and an adjunct lecturer at the Northern Caribbean University and chairman of the Kiwanis Club Student Leadership Program of New Kingston. She's a 2018 Chevening Scholar. She holds a Master in Public Health and Health Promotion with distinction from the Swansea University, Wales, and a Bachelor of Arts in Journalism from Karamak, University of the West Indies. She has worked with organizations like the International Planned Parenthood Federation, PAHO WHO, and she has moderated and presented on regional and international platforms, including introducing former New Zealand Prime Minister Helen Clark. Kimberly is passionate about mentorship, youth development, advocacy, and issues affecting rural and vulnerable population. She supports initiatives through her alma mater, Meadowbrook High School, and other community organizations, crediting her achievement to God and her late mother. Please put your hands together for Kimberly Hibbert. At this time, I'll introduce to you Mr. John Antoine, a senior research scientist at iSense for over 21 years. He leads the Nuclear Analytic Laboratory and he operates the Slowpoke 2 nuclear reactor, very high-tech instrument. He specializes in neutron activation analysis for diverse fields, including geochemistry, heavy metals, marine studies, and food research. His extensive contribution include peer-reviewed articles, 2 book chapters, and several technical reports. He also reviews for high-impact journals. Internationally, Mr. Antoine has represented Jamaica on nuclear safety, security, and research reactor management, and has consulted for the International Atomic Energy Agency. Locally, he chairs the Paint and Surface Coating Technical Committee and vice chair the National Mirror Committee for the ISO TC 93 STARCH, both managed by the Bureau Standard of Jamaica. He's also an active member of the ASTM International, and I'd like you to give an applaud to Mr. John Antoine. And our last panelist for this morning is Mr. Richard Rowe. Mr. Rowe is a former banker and current director of the Western Region with the Consumers Affairs Commission. He oversees regional operations, inspections, and field functions, supervising staff and supporting the director of field operations. He has over 20 years in the public service and is known for empowering others, notably his achievement of a 27.5 million refund, which was the CAC largest individual monetary compensation. He has an MBA in Leadership and Sustainability from the University of Cumbria, UK, and Robert Kennedy College, Switzerland. Mr. Rowe is the Deputy Chairman of the Jamaica Customer Service Association, a distinguished Kiwanian, having chartered the Kiwanis Club of Barbican in 2015 and receiving the Godfrey Dyer Medallion. I must say thank you to our 3 distinguished panelists for being on the platform with us this morning. And so we will start by asking each of you a question in regards to your background on policy, research, consumers affairs, and development. And so I will start with Mr. John Antoine. And your question is, as a researcher, what policies do you believe are necessary to combat lead poisoning? And each panelist have 10 minutes to respond to their question.
All right. Good morning, everyone. I'd like to thank Carpin for allowing me to speak on this platform. That is a pretty loaded question for my purposes, but I'm happy to address it. The International Center for Environmental and Nuclear Sciences is an agency of the Office of the Prime Minister now, under the science portfolio. We used to be under MSET, but that changed after the elections. We are also considered a special project by the University of the West Indies. So that's a marrying of the two, and it allows us a bit of flexibility in our research and how we approach issues of sustainable development. In that respect, we are not a policy-making organization, but our work has contributed in several ways to policies and policy-making decisions. Now, that in a way, a good example of that has been the committee, the Paint and Surface Coating Technical Committee that myself and Mrs. balancing is also a part of. We use research that was conducted at Hisense to advance the adoption of JS358, and that was 2022. It was adopted in 2023, and that limits the lead content of paint to 90 ppm, 90 milligrams per kilogram on our market. Now, that was just a step. And because what you'd want to be looking for is something, let's just say, and maybe I can start in this way with what my wish list would be: source mitigation and source elimination, right? So maybe this is not elimination because we can't eliminate, totally eliminate leaded paints from our market. There will still be a little. We have high-tech equipment. We will always find a little bit of lead in paint because it is naturally occurring. But to a level at least that we can continue to limit and reduce until it becomes no longer feasible to do so, because there is no real safe exposure to any amount of lead. The truth of the matter, however, is that the majority of our lead exposure, that is Jamaicans' lead exposure and contamination, as well as poisonings, have been historically linked to backyard smelting. There is a case of the Kintyre Basic School that was built on the tailings of a very old lead mine, one that stopped operating in the 1800s. But that aspect was more of lack of knowledge of where these things were, where these old mines were, and therefore, if that had been the case, no one would have put a basic school there. But apart from that, in general, it is backyard smelting. And you'll see numerous cases of poisonings, lead poisonings in Mona Commons. Frazier's Content is a very famous area where there was lead poisoning. And Raytown, a policy to ensure not only the proper disposal, but also the recycling of these hazardous materials. And in this case, I'm talking specifically about lead acid batteries. It's imperative. This has to be coupled with an obligatory monitoring program. Because the truth is, there's been no recent survey of what the landscape looks like in terms of lead content. We have the burgeoning issue of e-waste, and e-waste is a source of many hazardous metals. It is something that I personally, and I think my organization would love to tackle, and we will get into that shortly. But in this case, for e-waste, there tends to be quite a bit of mercury, quite a bit of cadmium, and quite a bit of lead. I note that the NSWMA has launched a campaign as recently, I think about 2 years ago, related to the proper disposal. And there was a public campaign, I believe, related to that. I think it's about 2 years ago. And this is very important. But again, we don't know the landscape. But if I were able to talk about what I would really want, it is something that Hisense used to do, and that is blood lead level monitoring. We did it specifically for projects, but if I had my way, what would happen is that a policy would be driven that allows us to monitor children between 1 and 5, 1 and 6 maybe, and to determine what the blood lead levels are in those children. And this is important. Let me tell you why. We use the USA's action level, which is 3.5. It's actually known as the blood lead reference value. And we use that. It is now 3.5 micrograms per deciliter in blood. We use that, and the US has their MO of deriving that value. That value is based on the 97.5th percentile of blood lead distribution in US children aged between 1 and 5, 1 and 6. So we in Jamaica have always used that level to determine whether a child is at risk, whether a child is poisoned, and so on. The truth of the matter is Those are different pathways of exposure. Those are different aspects. Environmentally, it is possible, even likely, based on our research, and this is research from 1988, that our soil lead levels are higher than the US, higher than many places in the world. And based on that, what you're looking at is a circumstance in which we may be either overestimating our exposure or underestimating our exposure. While I'm not entirely uncomfortable with using that number, it feels like potentially that is a stab in the dark. We could be missing something, or we could be over treating, to the sense that we may call a child lead poisoning when the child is really not, for all circumstances. I think it is imperative that we develop our own number, a number that is specific to Jamaica. And that number is going to be important in how we move forward. It's not divorced from our environmental work, but it has to be married. It has to be coupled with that work so that we have a really good idea of what we're looking at. So, what do we need in terms of policy? Well, strict regulations that regulate the importation of leaded paints. We've spoken about that. Toys, cosmetics, even you find lead in cosmetics, etc., from our market. So that's a source elimination. For things that we can't prevent, like we need to import and manufacture and recycle and dispose of lead acid batteries and electronics. We need regulations that prevent that backyard smelting and improper disposal, improper recycling. We need that to be not only strict, but enforceable. And this must be accompanied by a public health campaign. And finally, these must be underpinned by baseline research. In some cases, we need to know what is going on. We've done baseline research for our soils. We need to expand that. But definitely a monitoring campaign, an environmental campaign, but a monitoring campaign of at least our children, to get an idea of what the lead landscape looks like in this country. Because I think, apart from the sporadic work that iSense has done, so there was significant work up to about 16 years ago, 15 years ago, when I came to iSense, maybe 21 years ago. There was a very robust blood lead monitoring project, but we haven't done a lot since in terms of that. We have to revive that to a level, and this is going to involve the Ministry of Health and Wellness. But we have to revive that to a level that gives us an idea of what the blood lead levels in at least our children look like, so that we can start to develop the policies that will mitigate the impact, if any, and there almost certainly will be, of lead poisoning, of lead exposure, of lead contamination. And that monitoring campaign is what is necessary for it to be effective. Thank you.
Thank you so much, John. It's a lot of food for thoughts for us and also for our policymakers. I'll now go over to Mr. Richard Rowe from the Consumers Affairs Commission of Jamaica. And my question to you, Mr. Rowe, is what policies do you think are essential to address consumer needs in combating lead poisoning?
Okay, thank you. Thank you very much, Sharika. And let me just acknowledge our fellow panelists, Sir Antoine and Madame Hibbert, and those who have joined us on this platform. Good morning. I am really happy that you have extended an invitation to the Consumer Affairs Commission once again. And certainly from our perspective, lead poisoning is not just a public health issue. It's a consumer protection and human rights issue. Consumers have the right to safe products, clean environments and clear, actionable information. Now, Addressing lead poisoning effectively requires policies that are both preventative as well as responsive to the needs of our citizens, particularly those who have those groups such as children, elderly, and low-income communities. Now, we recommend the following policies very quickly, and there are 8 of them. Mandatory, and number 1 for us is mandatory labeling and disclosure. Now, clear labeling is, of all consumer products that may contain lead, including paints and toys and, of course, cosmetics. Sir Antoine alluded to some of those. Now, it's important that importers and manufacturers must disclose lead content levels and provide warnings where applicable. The second thing is a stricter import and manufacturing standards. Now, we must enforce national lead content limits, right, in consumer goods, harmonized with the global best practices. And I'm talking about like World Health Organization, the USA's EPA standards. We should implement mandatory testing and certification for imported and locally manufactured goods, especially those products that are targeted at children. Our own customs department is already doing a special training on the implementation of the special code that can assist us at our point of entry, and that has to be implemented as soon as possible. Now, safe housing regulations, that's point number 3. Mandate, lead safe housing certification for rental properties and public housing, especially for those built prior to 1978. There's a lot that happened before 1978, and I'm sure we can talk about that a little later. Provides subsidies or tax incentives for lead abatement, that is, the removal of lead-based paint, plumbing, or soil in older homes, those that were built prior to 1978. The fourth is about water safety and infrastructure updates. Now, it is very important that we adopt national policies to replace lead-containing water pipes and fixtures, particularly in schools, in childcare centers, in home for the elderly, for example, and in those low-income communities where some of these things can be taken very easily for granted, and transparent public reporting. The fifth has to do with targeted education and public awareness campaigns. And Sir Antoine also spoke about campaigns. We should launch sustained campaigns to inform consumers about sources of lead, health impacts, and prevention tips. We should include school-based programs to reach parents and children directly. The PTAs, for example, we could do some school tours and, do social media and traditional media, etc. as part of those campaigns. It's important. And number 6 would be screening and early intervention programs. We should mandate, routine blood lead level screenings for children at key developmental stages. Integrate lead screening into national child health programs and provide free or subsidized testing for at-risk populations. The 7th would be the legal framework, the recourse and enforcement. Now, we should strengthen consumer protection laws to hold manufacturers, importers, and landlords accountable for lead exposure. Ensure that enforcement agencies have the resources and authority to act decisively on violations. Yeah. And of course, an example of this would be a section of the Consumer Protection Act, which we implement, and that is section 22, subsections 1 to 4, that speaks to damage resulting from the use of goods or services. Number 8 now, and that's a final one, has to do with multi-agency collaboration. We believe that we should facilitate a coordinated action between consumer protection agencies, ministries of health, housing, environment, and trade. And of course, we need to add the academia to help to address these issues. And of course, if we can establish a national task force on lead and other hazardous substance or chemicals with consumer representation to guide policy and monitor progress, that would be our recommendation. Now, my friends, in closing, I just want to say that lead poisoning is preventable. What's needed is a comprehensive, strong, consumer-focused policy backed by enforcement, education, and access to safe environments. All of this is so very important. And the Consumer Affairs Commission remains committed to advocating for these policies and empowering consumers with the knowledge and protection that they need to live safely. Thank you very much.
Thank you so much, Mr. Rowe. Wow, a lot of information there for our upcoming discussion. And now I will be putting my evening scholar on the floor, Miss Kimberly Ibbert. And, you know, as evening scholar, which I myself am one, we always think about development within our country. Now, considering Jamaica's Vision 2030 and its commitment to the Sustainable Development Goals, what policies do you think are crucial for tackling lead poisoning? Ms. Hibbert.
All right, thank you very much, Sharika, for the invitation, and I'm happy to be here and to be sharing, I'm gonna say stage, even though we're not on a stage, with the other panelists. Before I respond to the question, I want to just underscore that, I'm in total agreement with what our two previous speakers, Mr. Antoine and Mr. Rowe, said, especially coming from Antoine's presentation about the need for us to have surveillance data, right? Because, if we are going to go forward with any policy at all, evidence is needed to drive the actions, right? So just to say, I'm in complete agreement with that. And in terms of lead poisoning, right? I do have a background in public health as well, but I want to say it's not just a public health issue, but it's also a development issue and a challenge, right? And it directly impacts several outcomes, such as educational outcomes, productivity, and overall quality of life. And if we're gonna go in line with Vision 2030 Jamaica and or Sustainable Development Goals, particularly goals 3, 6, 11, and goals 12. And in terms of what those goals speak to, goal 3 speaks to good health and well-being. Goal 6, it speaks to clean water and sanitation. Goal 11 speaks to sustainable cities and communities. And goal 12 speaks to responsible consumption and production. Right, so I'd say that there's an urgent need for a coordinated and a multi-sectoral policy approach to prevent lead exposure before it happens. And I heard elements of those coming out, especially in Mr. Rowe's presentation. I started laughing to myself. I said, well, I can, just don't bother to say anything since you've said most of it for me. But Jamaica would definitely benefit from a national lead prevention and control framework, right? And Ms. Antoine mentioned that a lot. And I think this framework should also bring together key ministries such as, the Health Ministry, Education Ministry, Ministry of Industry, Investment and Commerce. We would definitely benefit from insights from environment and local government, but this must be under one clear strategy, right? So this framework should include strict regulatory standards for lead in paints, toys, ceramics, plumbing materials, and also establish strong monitoring and enforcement systems. Now, whenever we're talking about policies and implementing things, we tend to stay away from issues that are too punitive in nature, because that in and of itself, will face a lot of resistance. But sometimes I do believe that, if there is some level of penalty, it might actually dissuade you from, going in contravention of what it actually says. Secondly, I believe that we need to also strengthen public health surveillance, as that's what I started off my response saying, so that lead testing becomes a part of routine screening, especially for high risk groups like children, pregnant women, the elderly. We could go on and on. And this, I believe, we have to have some level of surveillance, mandatory surveillance rather, in place, right? Because as I mentioned before, evidence will drive action. But if we don't have any thing to refer to, it's not as targeted or as impactful as you would, hope that it would be. I'm gonna come back to that shortly. And I also think that we must invest in public education and community outreach, right? When I did my master's, I focused holistically on health promotion and education. And I must say that, lead poisoning, it is preventable. And if we're supposed to really do prevention, how we know how prevention goes, it will require one, the multi-sectoral buy-in, two, a lot of public education and community outreach, right? We would prefer if this is something that is done from a bottom up as opposed to a top down approach, right? And you get your community involved, get the buy-in from all stakeholders, and pretty much, see how they do their own part in also helping to prevent, things like the backyard smelting, etc. Now, I want to say that, private sector also can play a vital role by investing in lead-free manufacturing and safe waste management, and supported by government incentives. Or what those incentives will be, I don't necessarily want to go into it, but I know that as a people and as people in business, we tend to like tax incentives. So whatever it is that can be done along that line, I think would be really beneficial. And preventing lead poisoning, it's also about protecting our people and preserving our human capital in order to fulfill Vision 2030. From a public health standpoint, right now, Jamaica is faced with what I call a double-edged sword. So we have an aging population, and we also have a population that is riddled with NCDs, right? So the people who are here from a health background will tell you that about a third of our population die from heart disease each year and hypertension related illnesses, right? So, we already have that dealing with. So now, if we look at the long-term impacts of lead poisoning, right, that is also pretty much a brewing storm just waiting to happen. So, I do believe that we need to ramp up our public education efforts. We need to also have a lead poison control, framework in place. So we need to ramp up our surveillance. And I did say I was gonna come back to surveillance, screening and clinical guidance. Now, early detection, and as Mr. Antoine said, if we don't know what we're working with, we really don't know how to respond properly. So the detection, it prevents irreversible harm to cognitive development, right? And I think some key actions that we could take from that could be to adopt the WHO's or CDC blood lead levels, thresholds for action, and standardized reporting across health facilities. I think we could also equip maternal and child health clinics to screen and refer, include lead testing in environment health outreach, right? So, when our public health nurses go around and, we do the routine vaccination, if we could find some place to, to identify these issues or refer to say, have you ever actually got screened for this yet? Include that in our environmental and public health outreach. Also, create an anonymized national lead exposure registry to map hotspots. So, I heard the names of certain communities coming out. I heard Kintyre, I heard Fraser's Content, and so forth. So that's good that we kind of have an idea of where some of these hotspots is, but as we said, we really don't have a clear or a true picture because we don't have the screening and the monitoring down pat, right? So that's my contribution to it. So I think we do definitely need the national framework. I think we need to also strengthen our public health surveillance and invest heavily in our public education and community outreach. When I used to teach health promotion at UTech, we used to have a health fair every at the end of the class, and the students would come up with some interesting tagline. And I challenged myself today to think of one. I wrote it down. I'm actually looking for it. Right. So check your space, keep lead out of the place. Right. So, something that is as catchy as two is better than too many. Right. That people will, latch on to, people will always remember at the forefront of their minds. And, or one of our heroes, Marcus Garvey says, without knowledge, our people perish. And a lot of times when you go into communities and you do the surveillance and you do your, your health education initiatives, you realize that it's just a lack of knowledge and ignorance. Sometimes that are preventing people from really, improving their health outcomes, and, having their health gains as well. So if we can really, get the health promotion efforts going and the health education and public awareness efforts going, I really do believe that in time we will be able to nip this in the bud before it becomes what we call in public health a wicked issue, right? So there's no end in sight and it becomes so tangled that, you just basically leave it, right? And just hope for the best.
Okay, thank you so much, Miss Ibert. You said check your space and keep lead outside your space, or is it outside your place? It's check your space and keep lead outside your place.
Please, right.
Place.
Mhm.
Okay, nice tagline. And yes, thank you. I'm getting so many inputs in regards to public health, in regards to screening, in regards to housing and water. And before we go into our summer session, now I have one question for all of the panelists, where you're each going to take a round to answer. You have answered it somewhat in your presentations, but just to get for you to be a little bit more specific, how do you think, how can public-private partnership strengthen Jamaica's lead exposure prevention efforts? How can public-private partnership strengthen Jamaica's lead exposure prevention efforts? And this time, each person can start answering according to who feels to go first.
All right, I'll go first. Right. From a media standpoint, right? A lot of times when we do public education and prevention efforts, we always think, how can we get the media buy-in? No, the truth is, media is a business, right? And I'm saying this from the point of view of a journalist, from the point of view of once being an associate editor responsible for health and news at the Observer. Media is a business and they watch their bottom line. So I think one way in which, public sector, what am I saying? Right, the partnerships can work is that put money into our media campaigns, right? Billboards cost a lot, right? television ads, they cost, and when I say a lot, I can literally put a dollar figure to it. If you're looking to run a media campaign on TV for a month, you're looking in excess of $500,000 for maybe 30 spots, right? And they're not primetime spots. So if you intend for your messages to reach a wide cross section, invest in the actual media campaigns. Don't create budgets that are unrealistic to put $100,000 there and think that that's not gonna work, right? So invest in the actual mass media campaign initiatives that are needed, right? We remember the Broadcast Commission ads with the little cat. We remember the commercials of, times gone by. Everybody remembers the Mother's Patty commercial, that song. Right, you see, Sharika is smiling. So if that's the way we are right now. So, whether or not these campaigns are on our billboards, on TV, on social media, or whatever, it takes money, right? So I'd say that is one way to put a lot of your efforts into the mass media dissemination for the campaigns.
Okay, thank you, Kimberly. And that is, it's quite interesting because, majority of the time, even when we think about funding and we're planning funding for public education program, most times someone from media is not really sitting around the table for that discussion to guide to even guide the decision-making process on exactly what is the money value to this type of program and what's the amount that is needed to make it sustainable and even to have the impact that is desired. So that is a very high point that you brought out in your discussion. And so now I'll hand over either to Joan or Richard to elaborate on the question some more.
Sorry. Yes. All right. So yes, a campaign, I believe that for us to achieve anything, we need to have that partnership, and public-private partnership is always a good one. The PSOJ has been running a particular campaign right now that I believe if we were to perhaps engage them and to look at how we could infuse this issue in that campaign, that might help. That might help. Academia is always a good place to what extent the courses are in, I mean, the involvement of some of these issues are being noted in the different programs, the courses that we're doing. I don't know how we could engage academia. But I think that's a very good one to engage the academia. But I agree with Madam Hibbert that speaks to the campaign, the media campaign, and I know it's going to be costly, but we're going to have to get it from somewhere. I don't know. And I know we had a discussion, Sharika, about where funding might be possible. And I believe that even this platform might just plead our case and make it possible for us here in Jamaica. But yes, those are really my thoughts. Yeah.
Thank you so much, Richard. And so what they say, save the best for last. And so now, Antoine, it's your time to elaborate more on what you think.
Right. Thank you. First, let me say that in listening to Mr. Rowe and Ms. Hibbert, after I presented, I thought If somebody did know better, they would think that we kind of almost colluded in our answers. I think it was really quite synergistic. And I think it's going to continue in my response. But let me say this, when I think of PPPs, as a research scientist, I'm always going to look at the private part of it and ask for money, right? That's where I'm going to start. But before I get to that, let me say this. What I would prefer, what I would like is access, right? I think that's really important. When I'm thinking, again, to go back to the Paint and Surface Coatings Technical Committee, what we required from the manufacturers was access to their product. If I'm going to start in the case of, let us say, environment or products in this case, so we talked about the cosmetics, we talked about, Ms. Hibbert mentioned ceramics, we talk about toys, we talk about all these consumer items that could be sources of exposure to the general public. I need access to that. I need to be able to test those. I need to be able to, and I can get that from the public aspect too. But it looks very good in terms of corporate citizenship if I'm getting that from the private sector who are bringing these products in, and these could be potential sources of exposure. Because I'm pretty sure no corporate Jamaica doesn't want to be the bad guy in this case. You don't want to be saying that you're exposing anybody. And I know that no one is, well, I would like to say that no one is doing it on purpose, right? Or doing it without any thought. We're doing it in general because we don't know, right? We're bringing in a toy. It's a bright yellow toy. Where was that paint coming from? What is the lead content of that paint? It's chipping off, it's exposing children, things like that. So in the first case, yes, I would want access to the product so that we have an idea again of what the exposure looks like. And then afterwards, the support, which I think I did say at some point on a JIS think tank, the support from the private sector in terms of that research. So somebody is helping me in the research, somebody is offsetting the cost of that research because it is pretty sizable. It costs quite a bit of money. Ms. Hibbert mentioned the cost of a public campaign. That's really expensive. I've been made aware of that recently, and somebody has to take that on, right? And I think it would be good corporate citizenship and citizenry if the private sector does help the public sector in that information campaign, because that's, I think, the most important part of this. Thanks.
All right, thank you so much to our three panelists. Can you believe it that I have over 4 pages of notes just from this discussion? And now the floor is open. Let me check the chat. The floor is open to anyone that has any questions to any of the panelists, or if you have a general comment or feedback from the session. It would be nice if you could just use the raise hand button so that you can be acknowledged, or you can type your questions in the chat. Is there anyone that has any questions? And I'm checking. I'm checking to see. I'm not, hold on. I'm not seeing any questions in the chat. And I'm not seeing anyone raising their hands. So in my head, I'm thinking that, okay, we're all still thinking because the information might be so much overwhelming. So what I'm going to do now, I'm going to go right ahead and I'm going to summarize some of the key points that came out from the discussion just for us to reinforce. And the panelists, you can add to it if you think that I might have missed something. But monitoring was a key point that came out from all the different discussion. monitoring for blood lead level, which would go into the surveillance program that Ms. Hibbert spoke about. And most interestingly, she talked about primary health care, and Mr. Rowe and Mr. Antoine went into the secondary healthcare aspect of it, where we are looking at vulnerable community health, looking at the vulnerable population and have some sort of subsidy incentive for them to do testing. Because at the same time, when we are asking persons to do testing, and if they can't afford it, if it's not accessible and if it's not affordable, then it would have defeated the purpose of that program. We on the public health, we look on protecting human capital in terms of the aging population and the NCDs and the long-term effect that lead exposure can have in regards to public health burdens and diseases. We look on different models that we can have. Mr. Bird spoke about adopting CDC models and looking on maternal and child healthcare model from the WHO perspective. She also spoke about a registry which came out both in Mr. Rose and Mr. Antoine presentation. Can we have a registry in Jamaica where we know exactly what is happening in vulnerable communities, how this can be tracked, and how we can use this data to strengthen the programs amongst our sectors in the country? We talk about enforcement. The Consumer Affairs Commission, you talk about housing regulation, you talk about border control and importation, you talk about water safety, which also impacts health because we all have to drink water. And everyone pretty much talk about public awareness, whether it's in a school curriculum program, whether it's engaging stakeholders such as the Parent Teachers Association, but most importantly, having a sustainable public education program where there is allocated funding investment to make this program a reality was a key point that is coming out. Having a national framework, having task force where we have different sectors being part of this task force for lead and for other chemicals. And the multi-sectoral agency not only should have health, but it should include trade, it should include academia, housing, and other stakeholder. A key point came about having sanctions, punitive sanctions that could cause a behavior change. So how does having penalty in place can dissuade persons or dissuade entities from doing things, having routine testing? And in regards to development, how can all of these programs help to strengthen Vision 30 or Vision 30 objectives and mission for the Sustainable Development Goals number 3, 6, 11, and 12 that were discussed. And we are foreseeing a partnership with the private sector organization of Jamaica, who is now running a particular campaign. So that was a key thing that came out from what Mr. Rowe would have said, that we can now have an engaging discussion with the PSOG because they're now doing a campaign and how we can tap into that. And we can leave with this thought that Ms. Hibbert gives to us. It says, check your space, keep lead out of your place. And I would like to say to all our panelists and all our participants this afternoon, thank you so much for participating. This session has been live streamed so that it's accessible to anyone who would like to go back and look at the session. You can take your notes from it and you can understand the different facets of lead exposure, how it affects population health, how it affects trade, how it affects academia, how it affects our policies, and how as a people, as a sector, we can use partnership and how we can work together with good funding, enough funding and investment in all the different sectors to strengthen the work that we have to do as a people and to strengthen our government that has limited resources to make our country realize Vision 2030. Thank you all for being a part of the discussion, and we will continue to have this discussion after this session. Thank you all, and do have a wonderful rest of your day for all persons who have joined. And I say bye-bye now from our webinar, International Lead Poison Prevention Week 2025. Thank you all. Bye-bye.
Thank you.
All right. Have a great day.
Have a
You too,
great one
everyone.
too.